My name is Dr. Satish Vaidya. I am a practicing cardiologist in the city of Thane, having my own cardiology nursing home and ICCU since 1980. I completed my MD degree in internal medicine and pursued the DM cardiology, the super specialty course of the Bombay University, and completed that in 1980. So, I obtained MD degree in internal medicine and DM cardiology from the Bombay University and started my practice in 1980. I was appointed as honorary cardiologist and honorary professor of cardiology at Grant Medical College and JJ Group of Hospital in 1983 and continued in the above post till 2007 when I retired. During this tenure, I not only treated all the cardiac patients in the ICCU and ward of the JJ Hospital, as well as trained the postgraduates to pursue the DM cardiology course. All the postgraduates were trained in treating cardiac emergencies, echocardiography and color Doppler, cardiac catheterization and angiocardiography, percutaneous coronary interventions, valvular dilatations called balloon valvotomies, as well as exercise testing and Holter monitoring. I was a guide for more than 100 postgraduate students and also an examiner for the DM degree of the Bombay University, as well as I was invited as an examiner to the other universities in India where this degree course is available. Currently, I am a professor of cardiology at the T.Y. Patil Medical College, Nerul, Navi Mumbai. I am also attached to Fortis Hospital, Mulund, Mumbai, Jupiter Hospital, Thane as interventional cardiologist, where I perform angioplasties, valvuloplasties, pacemaker implantations, whereas in the Rajiv Gandhi Medical College and Chhatrapati Shivaji Hospital, I am a visiting cardiologist where I teach the undergraduates as well as perform 2D echocardiography, exercise testing in the hospital to the needy patients. My both JJ Hospital attachments and the Kalwa Hospital attachment were totally honorary because I was not getting any pay for treating those patients. The incidence of heart disease is going up every day. This is the common question which is asked by a layman. Truly, it does go, it is still going up, probably because of increased awareness amongst the patients as well as the availability of investigative facilities in the nook and corner of the cities and urbanization. Now, the heart disease has got three main categories. The heart disease that occurs in children and newborns is called congenital heart disease, which is some defects, inborn defects in the heart. If you look at the heart, in congenital heart disease, there may be a hole in the partition which divides the two chambers, either here or here. There may be exchange of blood vessels which arise from different chambers, or there may be narrowing of the valves which are situated at the mouth of the blood vessels and connection between the two blood vessels. If possible, these defects can be corrected non-surgically as we do by placing a device in the hole, or they can be corrected surgically by my surgical colleagues. The second category, which is rapidly diminishing in our country, is called rheumatic heart disease, especially the children between the age of 3 and 10 or the school going children where they suffer from infection from streptococcal bacilli and they develop joint pains and that affects the heart valves. Many times this disease is forgotten and suddenly at the age of 12 to 15 the child starts getting symptoms And then we realized he has suffered rheumatic fever in the childhood, and now he has developed rheumatic valvular heart disease. Rheumatic valvular heart disease, when detected, also has treatment available and patient can lead a normal life. We cardiologists do what is called balloon mitral valvotomy by opening the valve, or the surgeons also can open the valve, or if need be, they go for valve replacement and patient can lead a normal life. The most dreadful disease among the heart disease is the coronary artery disease or heart attacks. Why it is dreadful? Because that is the only disease which can kill you instantaneously without any warning. And this disease occurs because of the narrowing of the arteries which supply the heart muscle, which is a muscular pump. And therefore, these are called the coronary arteries, and the disease is called as coronary artery disease. Now, why coronary artery disease occurs? Is because of the deposition of cholesterol and calcium in the coronary arteries without the knowledge of the patient. And what are the causes or what are the risk factors for development of coronary artery disease? It is hereditary. If your parents had suffered a heart attack, you also have got chances of developing heart disease. Then comes diabetes. The incidence of diabetes also is going up, and therefore the incidence of heart disease is going up. Diabetes is also responsible for development of atherosclerotic coronary artery disease. Third factor is hypertension, high blood pressure. High blood pressure is also hereditary as well as is related to the stress and strain of life. Fourth factor is hypercholesterolemia or what is called dyslipidemia. Increased percentage of cholesterol or LDL cholesterol or ApoB lipoprotein or LP small a. There are so many fractions which are responsible for developing coronary artery disease and narrowing of the coronary arteries. And therefore, these risk factors are not known to the patients, and suddenly he can develop heart attack which can prove fatal. The health has got a lowest priority in most of the patients. They don't go for regular checkups when they have no complaints. They go to the doctor only when they develop some complaints, by which time it may be too late. All these risk factors which I mentioned can be corrected. They are called modifiable risk factor. Hereditary, what you are going to get because of from the parents, you can't change. So they are called non-modifiable risk factor. But at least smoking, cholesterol, diabetes, high blood pressure can definitely be modified. And therefore, we have to insist on preventive cardiology. What is called primary prevention. Patients after the age of 35, another thing which I would like to quote, that not only the incidence of heart disease has gone up, but we see a lot of younger population developing heart disease. And what is the cause? Many times we have studied to find out the cause, and we found that patient didn't have any of these risk factors, but only cause was stressful life. People don't have time to de-stress themselves. They are so much involved in their occupation. They have no time to relax, and therefore the incidence of heart disease probably is going up. So what I mean by modifier risk factor is you must regularly check up your blood pressure and find out whether you need treatment for blood pressure. These factors not only affect the heart, but they affect your brain. You can suffer a stroke. They can affect your eyes. You can develop blindness. Affect your kidneys. You can develop kidney failure. And they can affect your blood supply to the legs, and you can suffer gangrene also. And these are called target organs. And these factors, they develop target organ damage. So before the target organ starts getting damaged, you must prevent that by controlling your blood pressure, by controlling your diabetes, by controlling your cholesterol. And what is the healthy heart? How to keep the heart healthy is to control and keep the enemies away from the heart. Those patients who are already diagnosed as hypertension, they must regularly take their medicines every day. And they should go regularly to their doctors to find whether the medicines that they are taking are effective, or the doctor can offer them better medicines. Those patients who have diabetes should regularly check their blood sugar and find out whether their blood sugar is under control and the medicine that they are taking are correct. or they need change of medicine, or they need better medicines. Research is going on in all these fields is so much that you regularly get newer medicines, better medicines, and therefore you have to upgrade your treatment by going to your doctor regularly for a follow-up. Same thing about smoking. Lot of patients who smoke because they are under stress, but that is not an excuse. Smoking is number one killer for heart. It's not only that patient develop heart attack, but smoking can develop lung cancer. So that is also, you get a statutory warning on the smoking pack, on the cigarette pack. Why not give a same warning for prevention of heart disease also? Third thing is exercise. If you do regular exercise, your blood pressure comes under control. You need less tablets. If you take regular exercise, your diabetes comes under control. If you take regular exercise, your cholesterol levels go down. So all these are beneficiary factors, and therefore we always recommend regular exercise for a healthy heart. And last and not the least is de-stressing yourself. Spare time for relaxation, spare time for listening to good music, spare time for reading a good book, spare time to seeing a good movie, spare time with your family. Go with your family for an outing, for a weekend. Forget about your occupation, forget about your day-to-day problems. That is the way of de-stressing yourself. This is called lifestyle modification or art of living. If you follow both physical exercise, regular control of your risk factors, and de-stressing yourself by any means, by lifestyle modification and art of living, your heart will be healthy for a longer time and will give you longer life. As per treatment of heart disease is concerned, those who have suffered already a heart attack or what is called an acute coronary syndrome, they also can lead a normal life. What we cardiologists do is to find out the blockade in the coronary arteries of the heart, and if possible, we go across that block with a wire and a balloon and place a coil or a stent or a mesh in the coronary artery in order to re-establish the blood supply. Now, it is the duty of the patient that this particular coil also doesn't get blocked, and that also needs the same precautions as far as maintenance is concerned. The same precautions like exercise, control of diabetes, hypertension, no smoking, and this cholesterol. There is another method for treatment of heart attacks and blockade of the coronary arteries, which is what is called coronary artery bypass graft surgery, popularly known as CABG, which is performed by the cardiac surgeons, where angioplasty is not possible. It is technically difficult and it is going to be not beneficial to the patient. We ourselves recommend the patient to go to the surgeons and they perform CABG on the patients. And what is CABG? The surgeon gets the blood supply from the main artery coming out of the heart and connects it distally to the blockade, so that even if that artery gets 100% occluded, the alternative channel is there to take care of the supply of the muscle, thereby preventing heart attack. In case of chest pain, how to prevent a heart attack? Lot of patients have their self-diagnosis. When they complain of chest pain, discomfort, they feel it may be acidity, it may be gases, and they delay going to the doctor. I always will say, any pain, any discomfort, don't wait, don't take self-medication. Go to the doctor, go to the nearest hospital to find out whether what you are complaining is heart attack or not, because even if one person life is saved out of 100, that is achievement in life. And 99 patients may not be having heart attack. They should not feel that unnecessarily we were frightened, but one person will definitely have a heart attack whose life will be saved. Because time is not money, time is muscle. If you suffer a heart attack and if you don't take treatment, the muscle is dead within no time. What is primary angioplasty in a heart attack has to be done within the golden hour, what is called 90 minutes. Unless you do it within 90 minutes from starting of the pain, the treatment is not successful. The patient's muscle will be dead. And therefore, we always recommend patients, not only for prevention, but for treatment of heart disease and heart attack, never to waste time. Even if it doesn't turn out to be a heart problem, at least somebody else's life will be saved. So, taking treatment for any discomfort, any chest pain, unexplained perspiration, giddiness, weakness, breathlessness should be immediately attended to. Don't wait for chest pain, especially for diabetic population. They don't get classical chest pain in a heart attack, so they don't bother to pay attention to any other complaint. In diabetics, if you get unexplained fatigue, giddiness, weakness, breathlessness, these are called angina equivalents. This immediately should be attended to. Angina means chest pain because of blockade of the coronary arteries of the heart, and therefore negligence is not advisable because that will lead to repenting in life. You try to understand the pathology of heart attacks, try to understand the causes of the heart attack, and decide the strategy. How am I going to prevent heart attacks and how am I going to treat in case I suffer heart attack, and motivate your friends and relatives and neighbors in order to understand the seriousness of the heart disease. I just spoke about primary angioplasty. We call it PAMI, primary angioplasty in myocardial infarction or heart attack. If a patient suffers a heart attack and he reaches a hospital within 90 minutes where coronary angiography is possible, if in case we find that the artery is totally blocked, we can reopen the artery and save the muscle. Such a patient can lead a totally normal life. Similarly, those patients who develop multiple blockade in the arteries and angioplasty is not possible, we only send them to the surgeons and they do coronary artery bypass surgery. These patients also can lead a normal life. These patients also have a longer life, provided, I repeat, provided they follow all the instructions of the doctors in the form of control of blood pressure, control of weight, control of high cholesterol, control of diabetes, regular exercise, de-stress yourself and stop smoking. If you want to be healthy, keep your heart healthy and therefore stay close to the heart and stay healthy.